Hello, everyone. My name is Jennifer Vrabel. I'm the Executive Director of Advancement at Berkshire Health Systems. I just wanted to let everybody know we're going to get started in just a minute. I know a few people we saw pulling into the parking lot. So if everybody could take a seat, we're very glad to be able to welcome you here tonight to talk about our project for expanding care in North Adams. Good evening, everybody. I'm Darlene Rodowitz. I'm the CEO and President of the health system. I want to thank you for coming this evening on a night when we can talk about such positive news for our community overall. Before we get started, I just want to thank MCLA for offering up this beautiful venue for us to have the meeting tonight. So thank you very much to everybody at MCLA that made this possible. I also want to recognize some folks that are in the room with us. Representative Barrett is here representing us, and he's been a tireless advocate of making sure we're always watching to see if there's an opportunity to reopen North Adams. I also want to recognize Mayor Maxey and former Mayor Bernard as well. So thank you all for being here. Tonight, what I want to talk to you about is expanding access to care in North Adams, or as we otherwise know it, reopening North Adams Regional Hospital, right? So I just want to, hopefully spend the majority of the time having a conversation with you, but I thought it would be important to give you a little bit of a background on how all of this came to be and some of the issues and restrictions we might have around critical access hospital as well, just so we all have a level set before we start that conversation. So I'll give you a little bit of a background. What is critical access hospital? Why is that designation important to us? How does it work? What does it mean for Northern Berkshire? What's the next steps? And then open it up for questions. So when we go to the background, I just want to remind you that in June of this year, we were able to announce this plan. And we were able to reopen the facility with the same name, and that was deliberate on our part. You've been living with the satellite campus of Berkshire Medical Center. And that was a requirement because North Adams was working under the Berkshire Medical Center license. And so by law, Berkshire Medical Center's name had to be in the name of the campus, right? And I know it didn't settle well with a lot of folks, but I grew up in Adams, and in my family, this place was always called the Reg, right? And we knew it was important to bring the Reg back to everybody. And so hopefully for most of you, that is a conscious decision on our part to respect the years of great work that has happened in this community and being able to bring that back to the community again. When we go back to 2014, it's the only time I'm going to talk about history here. But back in 2014, you may remember that the state commissioned Stroudwater to do a study on what the needs were with the closure of North Adams Regional. And in that study, it did indicate that there was a need for inpatient beds. But it was very clear that there could only be inpatient beds if we could get the critical access hospital designation. And at the time, North Adams was not eligible, and I'll go over why that was. But we've always been looking to seek this critical access designation since Berkshire's been involved. And I know that the previous board members tried to do the same thing as well. And with the critical access hospital, you can reopen up to 25 inpatient beds for medical surgical care. So what we've been doing is we've been working as a health system, just to give you a landscape, at reimagining our mission and vision, which is to advance health and wellness for everyone in our community in a welcoming, inclusive, and personalized environment. I think the biggest part about this mission statement is about not only caring for people when they need medical care, which is what we do in the walls of the health system, whether it's North Adams or Berkshire Medical Center or Fairview Hospital, but engaging in a different way with our community so that we can make sure that you're living a healthy life when you're not with or in the hospital and needing medical care. Because health is so much more than just the care that you receive. And so with the 4,000 people that work for us in the health system, we're really focused on trying to create a healthier county as a whole. And reestablishing these inpatient beds, we think, is a big part of that because it strengthens our ability to serve patients in North County. We've had concerns in the last 9 years that not everybody finds it easy to get to Pittsfield. And oftentimes people delay their care because of that. And so bringing beds back to North Adams makes it easier for people to receive their care and not have to think twice about whether they want to go in for something. Now, critical access hospital is important to us, but healthcare as a whole is still a business whether we like it or not. It has to be financially viable, and healthcare is a balancing act. And so we have to look at not only the needs of the community, but whether something we do, like opening a hospital, can it be sustainable? It would be a terrible disservice if we were to open it up and close it 2 years later, right? So we need to make sure when we're making this decision that not only are we meeting the needs, which we know exists here, but that it's something that can exist for years to come and that you can depend upon it. And so what is a critical access hospital? So a critical access hospital is a small facility. As I've already said, it can have no more than 25 inpatient beds. That's fewer than what North Adams Regional had when it was opened before 2014. It's a recognition from the federal government, and it recognizes the important role that healthcare provides to folks that live in rural areas. And although Berkshire County isn't nearly as rural as Wyoming and Arkansas, Nebraska, we are rural for the state of Massachusetts, and we're designated as rural in some of our communities as well. And this critical access designation, or CAH, C-A-H, is granted by Medicare or CMS, and it determines how hospitals are paid for government insurance, so folks that are on Medicare at the federal level. And Massachusetts also recognizes the critical access hospital, and so this designation is relevant for folks that have Medicaid, which is the state-sponsored government program. And so this whole designation was created in 1997, and there's over 400 hospitals that have been deemed critical access hospitals throughout the country. In fact, Fairview Hospital in Great Barrington is a critical access hospital that is part of our health system. So the designation itself is important because it ensures the financial sustainability of the health system, because healthcare is like putting a puzzle together. All the pieces have to fit. And so what you see here is, these government programs like critical access hospitals help to support rural communities. In addition to whether we're getting the right kind of payments from Medicare and Medicaid and the commercial insurances, or the pharmacy programs that we run are vital to the financial health of the whole health system as well as donors are very critical to a health system. So critical access hospital is just one piece of this puzzle of strengthening a health system and being able to provide services close to home. And the way that this works, and the reason why we're here today, is because one of the conditions of a critical access hospital is that you needed to be 35 miles between another hospital if there was a primary road. And in 2014, Route 7, just because it was a federal highway, was a primary road. And both Berkshire Medical Center and Southwestern Vermont were closer than 35 miles, and therefore North Adams Regional was not eligible to be a critical access hospital. What happened in November is that CMS, Medicare, changed the rules. And the change was this: the only federal highways that they'll recognize as a primary road for purposes of critical access hospital are those federal highways that have more than 2 lanes. Route 7, luckily, only has 2 lanes. So for all of us that wish we had big highways, Route 7 helped us this time. And so now the distance is only 15 miles. And both Berkshire Medical Center and Southwestern Vermont are more than 15 miles from the campus of North Adams Regional Hospital. So that is the why now. Why didn't it happen 9 years ago? Because the rules were different than they are now. So this is a really important piece that allowed us to move forward. Now, what is required in a critical access hospital? A critical access hospital has to provide 24/7 emergency care services, and we've been doing that for the last 9 months. And I see Luann Quinn here, who makes sure that our ED and every other facet of this campus works like a charm and is always there to meet your needs, right? We've relied upon Luann and her team for the last 9 years to do this very thing. So we've had that. You must maintain 25 or fewer inpatient beds. And when I say inpatient, we mean inpatient and observation. I don't know if any of you have been in the hospital, some of you have, but sometimes you may be laying in a patient bed, right, but you're not classified as inpatient, you're observation, which simply means that Medicare is going to pay you as an outpatient, right? And your copays are different. And by the way, those days that you're in a hospital bed don't count towards qualification to have Medicare coverage in a nursing home, unfortunately. So we're going to be doing inpatient and observation. The other thing that a critical access hospital offers that North Adams and Berkshire Medical Center have not previously been able to do is a thing called swing beds. And swing beds is the equivalent of a nursing home stay for short stay nursing home. So if you could think of if you had a joint replacement, a knee replacement, and the physician said you needed to go to a nursing home for 7 to 10 days for some physical therapy, you're going to be able to do that at North Adams. You're not going to need to go to a nursing home. If you had open heart surgery at Bay State and you need to go to a nursing home after surgery, you're going to be able to recover at North Adams Regional Hospital in one of these swing beds. So that's a new service that's never been available in North Adams previously, and this new designation is available, is part of the critical access hospital designation and will broaden what we can do for you. Importantly, other than the swing beds, everyone else in the inpatient bed has to have an average length of stay of 4 days. So by design, small hospitals, not really complicated cases, right? And I'll talk a little bit of some of the diagnoses if you had a curiosity on what those might look like. And importantly, critical access hospitals don't exist on their own. By design, they need to be part of the system. Because of the restriction on number of beds and length of stay, you have to make sure that there's a system of care. And North Adams Regional is part of Berkshire Health Systems. We have that system already. And so what's really important as a community member, and the way we want you to think about it, is when you need medical care or you're not sure what's going on, go to the hospital. And the professionals will decide what level of care you need and where you need to go, right? And the majority of things we're going to be able to take care of in North Adams, what we can't do in North Adams, we're going to take you to BMC. And what Berkshire Medical Center doesn't do, we partner with Bay State to do. And so those would be things like open heart, stents, NICU, things that we don't offer in Berkshire County because of the size of our population. We partner with Bay State to do those services. So it is truly a system of care for our community. And in these systems of care, you know, we look at not only this anchor of Berkshire Medical Center in the system, we have the critical access hospitals, which will be Fairview and North Adams. So we have now a whole system of care on a hospital basis from Vermont to Connecticut, from the New York border to the Pioneer Valley, right? And we also have all the outpatient services, and we've been building all of these outpatient services, and I'm sure you all know this, but everything that North Adams had on an outpatient basis already exists at the campus. And we're very proud of that. In fact, we've added cardiac rehab and renal dialysis that didn't exist before they joined Berkshire Health Systems. So it really is about this whole system of care, and importantly, trying to bring care as close to home as possible. And that's what North Adams provides for us, is that last piece of making sure you can stay in North Adams as much as possible. And so what does it mean for Northern Berkshire County? We think that it's an essential piece of providing care close to home. It provides convenience and comfort for patients. For a lot of folks, it's a really hard task to ask family members to take you to Pittsfield and come back and get you. We have patients that get sent to Berkshire Medical Center, and when they're ready to go home, they don't have a ride to get home. And so, you know, you're going to be able to have family around you a little bit more. And families are a critical part of a recovery and your overall health. Importantly, I see John Meany here and our EMS friends, but this is a huge benefit, I hope, to the EMS team, and we'll be able to reduce the amount of time that they're on the road, and they'll be able to respond to calls more frequently, or at least be a stronger organization financially. So a lot of opportunity there. It does provide important stabilization and transfer services when, you know, there's something bigger than what can handle in North Adams. Importantly, it provides financial sustainability, and it allows us to get other types of support. So a critical access hospital has unique access to loan forgiveness for physician recruitment, for example. So physicians that are looking to put down roots. We have something to offer in a critical access hospital that you can't get in a regular community hospital. So that's really important for us. And then I just want to talk a little bit about, maybe just to give some little bit of context around what kind of conditions we plan on taking care of in the critical access hospital. And this is just an excerpt of the highest diagnosis. It's by no means a complete list. But we looked at Fairview and said, what are the top diagnoses that we're taking care of at Fairview? Just so you can understand who we expect to be in these inpatient beds. But people that have pneumonia, maybe you have heart failure and you need a little bit of a tweak, COPD exacerbation, you just need to get tuned up, cardiac arrhythmias, urinary tract infections or UTIs, respiratory failure, chest pain and weakness, syncope and collapse, hip replacements, and post-surgical care. So our surgeons have been a little hesitant to do some cases in North Adams because we haven't had an ability to keep people for an extended time if recovery doesn't go as planned. And now with an observation designation, we're going to be able to do more surgeries in North Adams as well. So I think that's a really important piece of where we're at. So the next steps in the process, this is a very complex process. In fact, the time between November and announcing in June was really trying to understand what this process would be and making sure the state knew what we were trying to do as well. We have to first seek approval from the Commonwealth through a determination of need program, a process. So even though critical access hospital by its very name indicates there's a critical need and that could satisfy determination of need, in Massachusetts we have to go through a process of proving the need. And so we are hoping to file that application in the next week. The state has committed to trying to get the application deemed complete by the beginning of September. Those dates are important because that will tee us up to go to the Public Health Council in November. And that is the last approval we need to have a determination of need approval. Once we have that, we can apply to become a licensed hospital. So we are not reactivating the old license. This is essentially opening up a brand new hospital, even though we've been providing services there all along. We're opening up a new hospital. And then we apply to Medicare for a COT application, and we do that through the State Office of Rural Health. And I also want to call out Kathleen McGillicott, who is here from the State Office of Rural Health as well, in case there are any questions. And I want to thank her for her partnership and her willingness to support us through all of this. When all of that is done, then we have to go through survey processes with the Department of Public Health. We may need to open up first as an acute hospital, and then they'll come back and survey us as a critical access hospital. So really complicated, a lot of detailed steps, just sharing the work we're going to be doing between now and we hope sometime in around January. We put up here targeting early 2024 because there could be a few hiccups along the way, but we are targeting January of 24 as our best case scenario, just so you have that understanding. And I would just say before I open up for questions, how can you help? We'd ask that you take the time to spread the word about the benefits of COT to the community, to your family and your friends. We have, I think, letters of support that if you are interested in signing, we'd love to collect some letters of support from you, or you could write your own letters of support. And you can always contact us at community@bhs1.org with any questions or letters that you might like us to gather that we would put into the determination of need application as well. So with that, I just want to turn it over to the questions. And before I get going, I just want to say there are 2 microphones at the front of the room here. We are recording this session, and so we would like to make sure that we get your questions and everybody could hear your questions, and then happy to answer any of the questions. So if any one of you would like to get up and go to either of the microphones, that would be great. If you could introduce yourself and the town you come from, we'd appreciate that, and then ask your question as well.
My name is Eric Wilson. I've been in this community since I was a kid, and I'm glad you're doing all this and taking your time and all that. I want to ask several questions there. we don't just take out this North Adams. What about the like Savoy? Are they going to be part of this with a hospital? Wingtown, they need a hospital. All that, is that going to be for everybody? And another question I wanted to ask: are we still gonna is North Adams and Pittsfield and Vermont gonna still work together? You're not separating that, okay?
Yes.
Because I'm glad they're working together because no one hospital can't help everybody. Um, and another question too, um, on Mass Health, I'm representing people with disability. Um, so are you learning how to help us, to understand? I know that's been a process. I just wonder how far it's been. I've been in the hospital and they ask me different things about my anxiety and all that, and that's really good. And I hope you keep that up. I really appreciate that.
Great.
Thank you.
Well, thank you. So let me take you three questions. So the first one is, yes, North Adams Regional exists to serve the entire northern Berkshire community and southern Vermont. And so that includes all of the towns you mentioned, as well as Adams and Cheshire and Williamstown, New Ashford, right? So, and sometimes you might not even live in North County, but you might work in North County, and it's just where you're comfortable going. So we're open to anyone who wants to be there. And yes, we are a system of care. And so it is really important that you go to if you can go to your physician because it's not emergent, that's great. If you need hospital level of care, get to the closest emergency department. And then trust the professionals to get you to the right place. Okay? And then the third piece is, I'm glad you mentioned the disability. Charles Red is here somewhere. There he is in the back right here. He is our DEI officer, and that's diversity, equity, and inclusion. And so we are doing a lot of work in the diversity space, equity, including disability. Okay, so there's a lot of work. He could talk to you about all the details that we're doing in that space as well. Yeah, okay, you're welcome.
Hello, I'm Brenda Burdick. I live in Adams, and first of all, I'd just like to thank you for all your work that you're doing to bring the North Adams Regional Hospital back to North Adams. It's very exciting. I've lived in Adams all my life, and I actually just took my mom up there today for a procedure, and they're first rate, really great, so thank you.
You're welcome.
My other role is I'm the chair of the board for MCLA and the Board of Trustees. And I just personally want to thank you on behalf of the board for all of the work that you've done for us. As you know, Darlene, we have been doing a bachelor's of science in nursing. And we are just opening that starting in the fall of 2023. And so this will be the first Bachelor's of Science in Nursing program in Berkshire County. And it's the only Bachelor's of Science program within an hour's drive in the rural tri-state corner, like you mentioned, of Massachusetts, Vermont, and New York. And we really feel that with your help, this initiative will help address the current and future rural nursing workforce shortage. Again, I want to thank you for the help that you've provided in helping MCLA fund certain programs and startup costs, because that's been crucial as a partner to this program. And I just finally wanted to say that we fully support Berkshire Health System's plan for the critical access hospital designation and the reopening of inpatient beds in North Adams. Critical access hospitals for North Adams is a wonderful example of what can happen when people work together for a common cause. So thank you very much.
Thank you, Brenda. Yeah, I think, I also remember when North Adams closed, both MCLA and Williams College were really concerned about the students and which students would choose to go elsewhere because there wasn't a hospital nearby. And so I hope that helps with the recruitment process as well. MCLA has been a wonderful partner for us. I know some folks have asked, where are you going to get the staff from? There's a staffing shortage. Where are you going to find them? And it is a struggle. There's no doubt. We have about a 15% vacancy rate throughout the health system, not just in nursing, in every job. I don't know where all the workers went. Or maybe everyone retired, I don't know. But we don't have enough workers. And so we are spending over $7 million, have committed so far, in creating the workforce of the future through our career pipelines. So you're all here to spread the word. We are offering programs in LPN and RN, medical assistant, radiology, technology, and many other courses where we are paying a full 40-hour-a-week salary to students to go to school. In exchange, they work 8 to 16 hours a week for us. But what it has opened is the doors for folks that may have families and are stuck and want this great opportunity to have a wonderful career, but have to think about how to buy the groceries and pay for the rent. And so we are providing that salary to them to take that barrier away and hopefully encourage them to enter the workforce and to have a wonderful career that will hopefully reflect positively on their family and for generations to come. So we're very proud of that. MCLA is one piece of that. We partner with BCC and McCann as well. So spread the word. Anyone can call Human Resources at Berkshire Health Systems if someone has an interest in being in the healthcare career field. And we are making a significant investment. Now's the time to do it. We are dependent upon new graduates and training our staff. We have nurses that work in Pittsfield that want to come back to North Adams, and so some of them will be going back to North Adams. We're hopeful that some of the staff that may have gone elsewhere will come back to North Adams. Some may have gone to Vermont, some have gone to Bay State, and they may want to work closer to home again as well. So that's going to be the process. Our reopening is not going to be such that we open every bed day one. I think the prudent way of doing it is we're going to open 4 to 5 beds at a time and get those beds filled and work out any of the kinks we might have, and then open the next 4 to 5 beds until we get to that part. The other thing is that the first thing we're going to do is we're going to be opening up for all of you. You all know the hospital so well. So what we're opening is the old 2 North. And that unit will have 18 private rooms, 18 beds. Because this is a new license, a new hospital, we cannot have double rooms. So every room is a private room. Okay, so that will be our first foray. And then if there's demand, we have another 7 beds we can open on a different unit with another capital investment that we'll need to make. But the initial opening will have 18 beds. And again, as I said, we'll open with 4 to 5 beds at a time and then bring on staff as we see the demand coming our way. And I think it'll happen quickly. So that is what we're doing there. Yes.
My name is Barbara Malkus. I'm a resident of Clarksburg, and I am the superintendent for North Adams Public Schools. Could you please speak to how reopening North Adams Regional will benefit pediatric medicine and what services will be provided for children?
Yeah, that's a really good question. Pediatric medicine generally does not require much in the way of inpatient stays at all these days. In fact, the majority of pediatric patients that require hospital stay go to Bay State today. Berkshire Medical Center has a 5-bed unit. We typically have 2 to 3 patients, and they're usually very simple observation patients, dehydration, nothing very complex. Pediatric medicine relies upon, when they need hospital level of care, requires a lot of pediatric specialists and subspecialists, and you need to go to a tertiary or quaternary organization to get that. But we are hopeful overall that with this designation, we'll be able to attract more physicians generally to North County. If I think, back when that Stroudwater report was written, the other thing that needed to happen was that there were more primary care physicians would come into the county. And we have tried incredibly hard, as has CHP, and it's been really difficult to recruit physicians to North County. We've even paid a sign-on bonus that's higher if you'll go to North Adams or Great Barrington instead of Pittsfield. Right, so we're doing everything in our power. So we're hoping that this designation strengthens the delivery system that we have and makes it a more attractive place to practice, and we're not giving up on the recruitment. The other thing that we have is Berkshire Medical Center has 3 of its own residency programs where we teach physicians after they've finished their formal medical education. One of them is in internal medicine. And right now, we're making really good hospitalists. They spend almost all of their time in the hospital, and they're really comfortable with it. And so when they're done with their residency, they want to be a hospitalist somewhere, which is great. We need them. But what we're not doing is we're not making really good primary care physicians. So we are also pivoting our program to create a different clinical exposure for these residents in the hopes that they'll find it rewarding and want to join primary care, because oftentimes many of the residents that we train choose to stay in Berkshire County. I don't have anything specific. We're not going to have any pediatric beds, just to be clear about that, at North Adams. We're only going to have them in Pittsfield. And so, but most of the patients will be able to be, handled in the emergency department. We'll make that correct connection if we need to. Importantly, if we were to have pediatric beds, we would have to have a pediatric hospitalist, because the adult hospitalists are not properly trained to be able to manage a pediatric patient. And that's the reason why pediatricians and the pediatric care and inpatient level is so centralized in the large urban areas. I hope that was helpful. Okay. Yes.
Sheila Desati. And on that note, I just want to advocate for a maternity department. I don't know where it fits in, but we had an excellent maternity department, and it was groundbreaking in many ways, including like having a birthing room. They were like the first or second in the whole country to have a birthing room. And so again, I don't know how it would fit in, but I think it's very important to have maternity care and birthing.
Thank you, Sheila. That's an important point. We do not have plans to open a family birthplace. And it's not because we don't want to care for the community. It's because of where we are going with maternal care in this country. And I think it's a real issue for us that we need to have a discussion about, I think, as a country, and certainly I think as a Commonwealth. In order to open up a new birthplace, you'd need to have about 800 deliveries. We're not even doing 800 deliveries in the whole county, right? And the reason that is because it's incredibly intensive. To have a good family birthplace, you not only have to have OBGYNs, you have to have round-the-clock anesthesiologists, and you have to have pediatricians that are round-the-clock on call for a delivery. And they just don't exist in enough quantity to be able to do that and do it well. And so, but I am very concerned because not only did North Adams lose their birthplace, but Sharon, Connecticut lost their birthplace, and Columbia Green lost their birthplace. And so we are creating what we call these maternal child health deserts, where there's lots of geography, not a lot of people, and not a whole lot of care. And that's not to say that the solution is to bring back maternity wards or family birthplaces, but we have to think differently about how we care for the mom and the baby, right, while they're going on that journey. And so I think we need to do a better job of looking at how we can do remote patient monitoring so we can always keep an eye on the patient and the baby to make sure they're doing well, and maybe not have to come into the office quite as often. There are some organizations that have created homes so that high-risk moms can actually stay near the hospital when they get close to the delivery date. And so we're going to have to think creatively about that. But given the number of births, North Adams did, I think, about 160 births when they closed. There just aren't enough to justify and to get approval for a family birthplace here. So that's the reason why I just want to be really honest with all of you about what we can and can't do.
May I ask a question?
Oh, yes, I'm sorry. How are you, Diane?
Okay. My name is Diane Parsons. I live in Adams. And my question has to do with the number of beds. You mentioned in order to get the critical access designation, you needed 25 or fewer beds. My question is that all you will ever have, or is it likely to grow? And I have a second question as well.
Okay, so the first question, so by design, this is a federal regulation, we can have no more than 25 medical surgical beds that can also be used for swing beds.
Also, you need what?
Also be used for those swing beds, those nursing home beds. So the most we'll ever have for inpatient and observation beds at North Adams is 25 beds.
Well, my second question has to do with North Adams has become a bit of a rehab center, it seems, for drugs. At one time, we had a Greylock Pavilion at North Adams. I know you mentioned a number of health matters that you would be taking care of. I trust that's not an exhaustive list.
That's correct.
And it will there, because there might be a need for mental health care and drug care.
Yeah, so let me, again, at this point in time, we're not looking at opening an inpatient behavioral health unit. Critical access hospitals can open a 10-bed distinct part unit for behavioral health in addition to the 25 beds. We have 2 behavioral health units in Pittsfield today. Only one of them is open because that is the only inpatient demand that there is in the county right now. And that would surprise you, right? Because we've got a lot of issues. And that's not to say that there isn't need. What's happening with behavioral health and SUD is that more and more of the care is being managed in an outpatient setting versus an inpatient setting. And it's positive for the patients because they can remain working, they can remain engaged with their family, they can participate in daily living while they're getting outpatient care versus being institutionalized for a couple of weeks. That's not to say some people don't need the inpatient, right? But if you can manage the issues and manage them on an outpatient basis, that's the preferred way to go. So what we will commit to, and we are endeavoring, is to identify ways that we can provide more outpatient care in the behavioral health space. But I think particularly we have a particular interest in trying to understand what we can do for those that have a dual diagnosis, is what we call it, but an individual that will have a behavioral health issue or a mental health issue along with a substance use. And you know, if you didn't start with a mental health issue on your journey with SUD, after a few years, you likely have something, anxiety, depression, PTSD, right? So how do we help the person not only recover, but also receive the mental health care that they need so that they can feel good about themselves and become full citizens of the community again? That's not what's happening day one with critical access. We're really focusing on the inpatient beds. It's a huge lift to get these beds open, and I don't want anything to get in the way. But you have my word that we are working on doing something in that space, and I don't know the answer because there's a lot of insurance regulations on what we can and can't do, but we want to do that.
One more question about the short stay. The 4 days, is that dyed in the wool? I mean, is that going to, will that also always
Yeah.
be the case? And is that the case at Fairfield?
It's the case at Fairview as well. So every
Fairview.
every critical access hospital in the country, when we accept that designation, has to have an average length of stay of 96 hours or 4 days. We're in a much better place now than we were before. It used to be every patient could only stay for 4 days. Now it's an average. So if you have somebody that stays for 6 days and somebody that stays at 2, we've got an average of 4, right? So it has allowed us to think differently about who we're taking care of because of that.
Thank you.
You're welcome. I'll take you next.
Yes, I'm Paul W. Marino of North Adams, and I have a point of history to bring up to you. You mentioned that the first 18 private rooms will be on 2 North. Well, at some point, the North Wing was named the Larigo Wing after George Larigo, the longtime president of the hospital. And I would like to see that name brought back into use. So perhaps name that section on 2 North the Larigo Treatment Wing or
Well,
clinic.
Yeah, you know, we very rarely, I'll just be honest, we very rarely name a unit. even at this point for big benefactors, that's not to say it won't change. So I'll have to study up on that president because I'm not familiar with him. And I grew up in Adams, but I'm not familiar with him. So we'll look at that and love to
Okay.
have a conversation with you on the history, though.
All right, thank
That'd be
you.
great. Thank you.
Hi, Arlene, John Lipa.
Yes, John.
You and I worked on some boards together, and I'm glad you're the one that's shepherding us through this maze of bureaucratic stuff to get this hospital going, so thank you. I got two questions. One, because of the lack of primary care doctors in this area, does one have to be affiliated with a primary care doc associated with Berkshire Medical Systems in order to have access to this facility?
No.
That's
There's,
good.
yes.
That's
So,
good.
yes.
The second question, in the vernacular on the street, is this also considered urgent care facility?
No, so it's not. So you will have access to an emergency care, and when it comes to co-pays, it'll be under the emergency care. It's not an urgent care.
And where would urgent care be?
So we have an urgent care in Pittsfield, and we're looking at building one in Lenox. And urgent care is a really hard topic in Berkshire County. A lot of geography. You'd think we should have one in North and South County. But you really need a lot of population to make an urgent care work. And so we've engaged outside consultants to look at where can we make one work, where is it viable, and it doesn't contemplate one in North Adams or Great Barrington. I think it's something we have to think about, whether we could, in our perfect world, we will get enough primary care physicians and APPs, advanced practice providers, which is PAs and nurse practitioners, physician's assistants and nurse practitioners. Our goal is to be able to see you the same day in an office so that you don't need urgent care. We are not there yet by any means. But that is what we are driving toward, both through recruitment as well as efficiency in how we're running the office so that we can prioritize patients better. It is the hard part of living in a place like Berkshire County. There's so many things that are positive. There's beauty around us everywhere we look. And yet it's a lot of geography and not many people. I don't know if any of you realize this, but the entire population of Berkshire County is smaller than the population of the city of Springfield. So when we're trying to scale things up, our challenge is there aren't a lot of us. And how do we make it work when there aren't a lot of us? Yeah, you're welcome. Yes.
Yes, I'm Marty Greenstein. I live in Williamstown, and I worked at the original North Adams Regional Hospital and retired from there and was a volunteer there after retirement, as well as for BHS in the emergency room. My question is about a patient who needs intensive care. You referred to the connection with Bay State Medical Center, and if a patient needs intensive care, are they more likely to go to Springfield or to Pittsfield?
Again, it's going to depend on what the patient is presenting with, as well as the other conditions that the patient is dealing with, or what we call comorbidities. We have a really good intensive care program at Berkshire Medical Center. We have some intensivists I would stand up to anybody in Boston and New York. They do amazing things. And so we will manage most patients in our intensive care unit. Again, if you know you're going to need open heart, we know you're going to need a stent. If you have a severe pelvic fracture, those are some of the things that we don't take care of in Pittsfield. And that's when the AD physician will triage you directly to Bay State, right? But if you put your hands in an emergency situation like that, the emergency physician will get you to the right place. And we're always going to try and keep you as close to home as possible.
Thank
Right.
you. I know it's a bumpy ride to Pittsfield, but it's more of a bumpy ride to Springfield.
Yes, it is. And thank you for your support. Yes.
Hi, I'm Tamara Cloudis. I'm from Williamstown, Massachusetts. And I just want to appreciate all your work on opening up North Adams Regional Hospital as part of the North Adams community healthcare system. At the time it closed, it was very traumatic for all of us. And so appreciate that very much. My question is, because I work in the home care division now, and the short stay and means quick turnover, recently, we had to stop our services to 15 towns because of lack of staff and losing so many employees. So you were talking about the investment in recruiting people. Are you guys looking at, because I also go to local primary care office and lost my primary care physician and see that turnover too. So are you guys looking at investing anything more into the staff that you have present so we don't have that turnover like you are investing into recruiting new staff?
Yes, we always make that investment, Tamara, and I know you're at the negotiating table, so I'm going to leave that discussion to the negotiating table, but we strive to have a fair contract with all of our employees. There's no reason for us to do anything but pay a fair price and to provide a good working condition. We can't provide care to our community without that. So I trust that that conversation will go on really well at the negotiating table.
Okay, because we've been there for a year now. And yes, I'm a co-chair, but I was just curious, the overall plan on everywhere,
Yeah.
whether there was anything in that part of it, since we've had to close services to 15 towns.
We have. Yeah.
So,
Many of those towns we haven't seen people in 12 months, as I understand it as well.
well, we won't get into all those details. I just meant general, because I don't want to take away from the
Sure.
positive part of what you have created and the work you've put in and everybody's put into that. Because that is that's
Great.
greatly appreciated by all of us.
Thank you. Anyone else?
Hey, Darlene.
Hey, Tom, how are you?
Good. Tom Bernard, North Adams. So the question, you've talked about clinicians and APPs. As you open, will there also be, facilities and operations and hospitality support? I really appreciate that Brenda talked about the nursing program and Dr. Malkus talked about the schools and pediatric needs. But I mean, we have the resources of BCC and Taconic and McCann to help meet that need, and that's another pathway. So could you just talk about where that fits into the picture as well?
Yeah, so,
Thanks.
to open the inpatient unit obviously requires nurses, it's going to require some hospitalists, which is a physician role. It's going to require nurses aides, unit coordinators, more folks to work in the dietary. We serve lunch to our staff right now. We're going to need to serve meals to our patients. So that's a new role for us. More housekeepers. I think, I don't know that we'll need more engineers to take care of the campus. We may. We're going to watch that carefully. We don't see a change in areas like radiology, maybe one more in the lab, places like that. But we're being very thoughtful about what positions we need, so we'll have success there. So yeah, I think it's a lot of good opportunity. Last I saw, I don't want to quote a number, but it's at least 50 people. Some of those people might shift from Pittsfield to North Adams. Some of those jobs might shift, and others will be new. Yeah. Anything else? All right, well, thank you very much. I really appreciate the time you've given us. All right.